As we navigate the summer of 2025, the landscape of COVID-19 is once again changing, bringing with it a new set of challenges and questions for all of us. A new version of the virus, a variant named NB.1.8.1, has become the most common strain across the United States. Scientists have noted that this particular variant spreads more easily than its predecessors and seems to be better at getting past the defenses our bodies have built up from previous infections or vaccinations. While many of the symptoms remain familiar, such as fever and cough, people infected with NB.1.8.1 are increasingly reporting an unusually painful sore throat, which some have described as feeling like razor blades. This development serves as a critical reminder that the virus continues to evolve. In the midst of this viral evolution, a significant and unexpected change in U.S. public health policy has occurred, creating a great deal of uncertainty for American families. On May 27, 2025, the Department of Health and Human Services, under the leadership of Secretary Robert F. Kennedy Jr., announced a major reversal of previous guidance. The new federal recommendation now states that COVID-19 vaccines are no longer advised for healthy children or for pregnant women. This updated policy narrows the scope of vaccination, limiting the official recommendation primarily to individuals who are over the age of 65 or those who have underlying health conditions that put them at higher risk for severe illness from the virus. This abrupt policy change was followed by another surprising move in early June. The entire Vaccine Advisory Committee to the Centers for Disease Control and Prevention, a group of 17 independent scientific experts known as ACIP, was dismissed. Secretary Kennedy explained this decision as an effort to restore public trust in the nation's health institutions. He quickly appointed a new panel of members to advise the government on vaccine policy. However, this new committee has drawn sharp criticism from many within the established medical and scientific communities, who have raised serious concerns about the qualifications and backgrounds of some of the new appointees, pointing to past statements that question the safety and effectiveness of vaccines. The combination of a new, more transmissible variant and a sudden dramatic shift in federal vaccine policy has left many people feeling bewildered. The virus itself is presenting new challenges with symptoms like the severe sore throat associated with the NB.1.8.1 strain. At the same time, the official guidance that families have followed for years has been fundamentally altered, seemingly overnight, and without the traditional scientific review process that the public has come to expect. This has created a vacuum of clear, consistent information, leaving many to wonder what the right course of action is to protect themselves and their loved ones from getting sick. The new federal guidance has created a deep and troubling divide between the U.S. government and the nation's leading medical organizations. While the government now recommends vaccines only for older adults and those with specific health risks, this advice stands in stark contrast to the recommendations from groups that have guided patient care for decades. Organizations like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and the American Medical Association have all publicly condemned the new federal policy. They argue that this change was not based on a thorough review of scientific evidence and that it could leave vulnerable populations, including children and pregnant individuals, unprotected. In a powerful response to the government's new stance, the American Academy of Pediatrics, which represents pediatricians across the country, has announced that it will publish its own, separate immunization schedule for children. The organization stated that it no longer considers the federal process to be credible and is committed to providing parents with advice rooted in established scientific data. Similarly, the American Medical Association, along with more than 80 other professional medical societies, released an open letter to the public. This letter reaffirmed their collective trust in evidence-based immunization practices and urged families to continue following the advice of their trusted physicians rather than the new, politically driven federal guidelines. This disagreement extends beyond our nation's borders, putting the United States at odds with global health authorities. The World Health Organization, for instance, continues to recommend vaccination for a much broader group of people. Their guidance includes individuals who have never been vaccinated, older adults, people with compromised immune systems, those living in long-term care facilities, and pregnant women. The World Health Organization's position is based on a global assessment of data, which continues to show that the benefits of vaccination in preventing severe disease, hospitalization, and death outweigh the known risks for these groups, even with the new NB.1.8.1 variant circulating. This clash of recommendations is at the very heart of the confusion that so many people are feeling right now. On one hand, you have the official position of the U.S. federal government, which has dramatically limited its vaccine recommendations. On the other hand, you have a unified front of doctors, pediatricians, and global health experts who continue to advocate for broader vaccine use based on their interpretation of the scientific evidence. This leaves families caught in the middle, trying to decide which group of experts to trust when the advice they are receiving is completely contradictory, making personal health decisions more difficult than ever. For parents and individuals trying to make sense of this conflicting information, understanding the basics is a crucial first step. The COVID-19 vaccines that are currently available for the 2024 to 2025 season were updated to target the JN.1 family of variants, which is the lineage from which the new NB.1.8.1 strain evolved. The main vaccines available in the United States are the mRNA vaccines from Pfizer-BioNTech and Moderna, which are approved for use in everyone aged 6 months and older. There is also another option, the Novavax vaccine, which uses a more traditional protein-based technology and is available for individuals who are 12 years and older. The recent policy changes have created significant confusion, particularly among parents of young children. Many are now unsure whether they should follow the advice of their pediatrician or the new guidance from the federal government. This dilemma has been made worse by the fact that the CDC's own website, a primary source of health information for many Americans, is in the process of being updated to reflect the new, narrower recommendations. This has left a void where clear, consistent, and easily accessible information once stood, forcing people to actively seek out alternative sources to make informed decisions for their families. Beyond the confusion, the new federal stance may also create practical barriers to getting a vaccine, especially regarding cost. In the past, COVID-19 vaccines were provided at no cost to all Americans. However, with the new policy recommending them only for specific groups, there are growing concerns that insurance companies may stop covering the cost of vaccination for people who are no longer in a federally recommended category, such as healthy children or adults under 65. If insurance coverage is dropped, the out-of-pocket cost for a single dose could be around $200, making vaccination unaffordable for many families who may still want it based on their doctor's advice. This situation puts an enormous burden on individuals to navigate a complicated and fractured information environment. You have to consider which vaccines are available, who they are approved for, what the different expert groups recommend, and now whether you will be able to afford the shot. It is a confusing and frustrating position to be in. Knowing the basic facts about the available vaccines is a starting point, but it's clear that families need more support to bridge the gap between the conflicting advice and the practical realities of accessing healthcare in this new landscape. In times of uncertainty and conflicting messages, the most important thing you can do is turn to a trusted, credible source for guidance. The person who knows you and your family's health history best is your own doctor or your child's pediatrician. They are your most valuable resource. Schedule a conversation with them to discuss your specific situation. You can ask them questions about the new NB.1.8.1 variant, the risks and benefits of the current vaccines, and what they recommend based on your age, health status, and personal circumstances. They can help you cut through the noise and make a decision that is right for you. It is also essential to be mindful of where you get your health information. The internet is filled with opinions and misinformation, and it can be difficult to tell fact from fiction. I urge you to rely on the websites of established medical organizations, such as the American Academy of Pediatrics, the American Medical Association, and the American College of Obstetricians and Gynecologists. These groups continue to provide information that is based on a rigorous, evidence-based scientific process. They are committed to public health and are working to provide clarity during this confusing time. Remember that the scientific community is constantly learning and adapting as the virus changes. The recent update to the warning labels for mRNA vaccines is an example of this ongoing process. The FDA has specified that the rare risk of myocarditis, an inflammation of the heart muscle, is about 8 cases per 1 million doses for the most recent shots. Being transparent about even very rare risks is a key part of building trust and helping people make fully informed choices. This kind of detailed information is what you should look for, not broad, unsupported claims that create fear and division. Ultimately, your health decisions are personal. The goal is not to be swayed by politics or fear, but to act on the best available information to protect yourself and your community. Stay informed by seeking out reliable sources, have open conversations with your healthcare providers, and trust in the scientific process that has guided medical progress for centuries. It is by taking these thoughtful steps that we can best navigate the path forward, ensuring our decisions are grounded in knowledge and aimed at keeping our families safe and healthy.